welcome to this week's episode of Healthy Conversations, presented by Athens-Limestone Hospital, where we explore the people, programs, and care that keep our community healthy and thriving. I'm Susan Claiborne, joined by Karina Farr, and today we're excited to welcome two special guests, Caroline Canestrari, Director of Athens-Limestone Hospital Foundation, and Bret McGill, Director of Emergency Services. In this episode, we're taking a closer look at the Foundation's annual giving and employee giving, how they work, where the funds go, and the real impact they have on our hospital and the people we serve every day. So Caroline, tell us just a little bit about the Hospital Foundation and its mission.
Okay, so thank you so much for having us today. The Hospital Foundation was founded by the Board of Directors in 1999. The foundation has grown to be able to fund many projects and services and programs of Athens-Limestone Hospital. We are a nonprofit 501c3, so we raise funds to raise money for programs, services, critical equipment needs for Athens-Limestone Hospital.
Yeah, that's great. Can you tell me a little bit about employee giving and what that is?
So our employee givers are a huge part of the Hospital Foundation and giving back to the hospital. We have over 400 employee givers, and the way it works, they give an amount out of their paycheck every month, every paycheck, and that goes to fund our Helping Hands grants. Helping Hands grants are available to every department and every clinic within the hospital, Athens-Limestone Hospital, and they can apply for a grant up to $3,000, and it can be for anything that they need in their department that's going to improve their environment, patient quality and patient care, and something that they need that may not be in their budget. We are able to present these Helping Hands grants to our foundation board meetings every other month, and they usually all get approved, and we've been able to make tremendous differences for the hospital and a lot of upgrades, a lot of equipment, and really improved patient care because of our employee givers. So they are a vital part of the Hospital Foundation.
Yeah, that's great. So you touched on the importance of the success of the hospital, but I'm also interested in you personally. What made you want to get involved with the Hospital Foundation?
Okay, yeah. So I actually started working in the nonprofit world back in 2014, and you know, as time went on, I was really blessed for an opportunity to start working for the Hospital Foundation in Athens, and I started out working in Huntsville, but I was living in Athens, and I really wanted to work, you know, locally in my community and be able to give back, and this opportunity arose, and it has been such a blessing in so many ways in my life. The people I work with are incredible. The staff at Athens-Limestone Hospital are amazing people and truly are a pillar of our community in providing the best health care. And to be a part of that and be able to raise money that's going to improve the well-being of our community is really meaningful to me. And I'm so thankful to be where I am and be able to give back and improve our hospital and patient care.
Well, I know we're glad to have you at the hospital. So Bret, you kind of see employee giving kind of firsthand. Kind of tell us a little bit about like where you work in the hospital and kind of how employee giving has impacted your department.
Okay, I'm over the emergency department and ambulance service, and so I'll tell you personally how giving affects what I do and why I believe in giving is that, you know, if you're in healthcare, it's service oriented. And so what we do and what we are allowed to do to help somebody at their time of need, and we get to see them on the front line, the emergency department and the ambulance service take care of people who they're probably having their worst day when we get to take care of them. And so we already have a servant's heart. And to me, the foundation helps us. They come alongside us and they provide us extra things that sometimes maybe it's not in the budget, or we didn't necessarily plan as well as we should have planned because we're so busy with our day-to-day. Things come up in the middle of the year, and the foundation offers us opportunities that we can go to them and fill out the information, fill out the request, and they have helped us tremendously over the years, just since I've been there, and I've been here for 3 years. So if you have a servant's heart, then you've got to give back. There's no other way. You don't really have a servant's heart if you're not giving back. And so I'm a member. I give out of my paycheck, and I encourage all my employees to. And we directly benefit from that. So I'd be kind of embarrassed if I came to Caroline and asked for something, and yet I wasn't a giver myself. So that's just part of the service, is that we want to give, we want to help out, and the foundation is a huge partner for us.
I think that's one of the beauties of the program is the employees in the hospital get to see that tangible evidence of where their money, their donations are being seen. And I know y'all had gotten some new equipment for, I think, the ambulance services, some kind of little monitor or something that helps in the field.
Put in, we have to give medicines in the back of the ambulance, and that's probably the what we would consider an unstable environment. It's not as stable as being in a hospital where things are controlled. So it's kind of it can be a little dangerous. And so when you're giving medicines to a patient, you want to be as accurate as you possibly can, and you want to provide the opportunity to make sure that everything you're doing is correct and it's the most beneficial to your patient. So they have these transport pumps, and they truly are not much bigger than a cell phone. We program them, and we can put our medicines in the pump, or we put the tubing in the pump, and then that allows for the exact, accurate administration of the medicine. So we had to use pumps. If you've ever been in a hospital, you know the pumps that they use that hang by your bed that beep so annoyingly during the night. So those things are huge, and that's not the most, the best way to administer medicine. So we were able to go to the foundation, and they purchased us a couple of those, what they're called Sapphire transport pumps. And they're very small. They will hang. A lot of times they'll get a carabiner and they'll hang the pump, right off their shoulder. And the medicine's being infused, it's exact. And so it's just a safer way for us to be able to do what we do, but do it in a way that is very mobile. And so the ambulance is very mobile. And so that's just one opportunity that we had to partner alongside the foundation, and it really made a huge difference. It just made their job a little bit easier, but more important, it was safer.
Would you say that affected the morale of your team as well, getting that gift?
It
from the
did.
foundation?
Sometimes they look at these larger ambulance services that have a lot of other resources than we do, and so they get some of the cool stuff. EMTs and paramedics are all about the cool toys, and so when we were able to do that, it really did kind of make us feel, like, hey, we're kind of in the big leagues now. So, but we couldn't have done it without the foundation. And something I wanted to say earlier is, a lot of folks, they want to serve and they have a servant's heart, but they really don't want to see all the stuff we see in medicine. They can come alongside the foundation and they can give, and their money goes to help, maybe in an area where they themselves can't serve, but wow, they're making a huge impact because they're giving me the tools to do what we do. So that's another reason.
And I want to highlight that. I want our employee givers and our supporters in the community and businesses that support our events and give an annual donation to know what a difference they are making in the lives of not only our patients but our staff. They're improving the quality of care. There may be a piece of equipment that we need an upgrade that we weren't able to make, but we were able to do because of the foundation and their support. And our employee givers are the exact same. They have really enabled us to do a lot and have given a lot of money to the foundation to give back and put back into the hospital.
Yeah, we've been talking about employee giving, and I know the employee giving kind of works where there's a request made and there's kind of a limit on what that request can be. But it's kind of the same process with annual giving, but our annual giving is kind of where the community gives, but you've got each year certain larger projects that those monies go to?
Yes, so every year we look at different needs within the hospital. Of course, there's a lot of needs, and we prioritize and think, okay, hey, what do we need to raise funds for this year? This year we looked at some different needs, and the hospital is in critical need of some new BiPAP machines. BiPAP machines, they are a type of machine that is a non-invasive way to aid in breathing for the patient. Hospital equipment is used 24/7, 365 days a year. So some equipment, it becomes out of date, so you aren't able to replace parts. And this is one of the things that we need an upgrade on. And so we have an annual campaign called the Different Society. This is an opportunity for individuals in the community and businesses to support on an annual basis. You can give a monthly recurring donation, or you can give one donation. It doesn't matter if the donation's $10 or $2,000. I can promise you that everything adds up to make a tremendous difference. In the past, we've been able to raise money for 10 brand new state-of-the-art ICU beds because of the Different Society and annual givers. We've been able to provide new fetal heart monitors for the mother-baby unit, and also a new echocardiogram ultrasound machine for imaging. So those are just examples of what our annual givers provide for Athens-Limestone Hospital.
Yeah, and those aren't cheap. That's
I would say,
that's
as
some
someone
pretty.
who's not in medical, like how much, just a ballpark for these big medical equipment, how much does that usually cost to replace?
Equipment is very expensive. Medical care is very expensive. So BiPAP machines, you're looking at around, we want to raise at least $30,000 for that project. And I know the ICU beds, we raised $160,000 for that.
Yeah, I knew that one had to
yeah.
be a big ticket item.
That was a big one. That was a big one, and we were really excited.
How long was that campaign? to raise
Usually
money
our
for
annual
that?
campaigns,
Was it
our
just a year?
calendar year, we
You
start in
were
January.
able to raise that much in a year?
Yep,
That's
and,
awesome.
and the way we do, we set our goals in the beginning, and we work throughout the year, and quarterly we'll kind of reevaluate where we are and see, okay, what do we need to do to maybe up our donations? Do we need to do a social media push, or maybe send out a letter, or push something out on our website? There are different ways to really push a campaign and spread more awareness.
Yeah, so you have different events that raise for specific things, but annual giving, like you said, is the whole calendar year. So anybody can give at any time of the year towards the annual giving.
Anybody can give. There's a link on our website that you can donate through the website. We accept all forms of payment, cash, credit card, check. You can give through our website. It's we try to make it as easy and convenient as possible for our givers to support and make their donation.
Yeah, I love the monthly giving because I'm one of those people that I just don't write checks that much. I don't kind of sit down monthly and kind of handle things. So it's kind of nice to be able to sign up and just kind of do a set amount every month and not think about it, but know that it's going to what you have selected. So
yes, monthly giving
that's
is
pretty cool.
awesome. And like I said, the amount of the donation, whether it's a smaller donation or really large, they are all important and critical to the overall goal of raising funds for that project.
That's awesome.
Now, Bret, I'd love to hear from you a story of maybe a personal experience you had with some new equipment. I know HIPAA, we don't want to get into anything too much with patients, but if you have a story you could tell about the impact.
Well, one of the pieces of equipment that we bought, or that we were able to get through the foundation, is called a Lucas device. And we had some Lucas device. We put one on every ambulance. And so you got to realize we have 14 ambulances, and any certain day, 10 of those will be on the road. And so we have a budget, and we put in for things, but the Lucas device was about $18,000 a piece.
And what does that
So
do?
the Lucas device is a CPR machine, basically. Okay. And so what it does is you wrap it around the patient, and then you push a button, and you get everything set, and then it performs CPR. So every patient that suffers a cardiac arrest, we try to deploy that machine. That machine gives us consistent compressions. The machine doesn't get tired. I've got extra batteries, so when the battery starts getting low, you get an alarm, we stick a new battery in. So the consistency with the way the CPR is performed, it's consistent CPR, which is better for your patient. So there's a ton of research. So we were, when I started, that was one of the things we said. We want a Lucas on every truck. So every cardiac arrest patient that meets the criteria, they're going to get that machine. Well, we realized early on that when EMTs or paramedics would come into the hospital with a patient who had a Lucas deployed, they might get another call before they were ready to take that machine off. Well, next thing you know, we're sending them out on the next call, and they didn't have a machine because they didn't have enough. So we partnered with the foundation, and they actually put one. So now I have one in the emergency department. So now when they come in with a patient in cardiac arrest, if they get dispatched on another call, they just pick up the one that's in the ER, and then they leave the one that they deployed on the patient in there till we get through with that patient. And so The other thing that did it kind of was twofold. Now the emergency department is using that same piece of equipment on patients that they have who come in who are in cardiac arrest. It really does improve outcomes, and that's the main thing. So it was one of those things where you can budget, but when you budget, we have to, like your home, you have to budget and you have to plan things, and sometimes you have to delay the gratification. And in medicine, when we've got cool pieces of equipment that really make a difference, we don't want to delay. And the foundation helps us. Sometimes when we didn't have the money in our budget, they come alongside us and they pick up the slack, and we were able to do that. So I don't really have a specific story, but you would not believe the number of times per month that machine is used, and it's so successful. And so what it does in the back of the ambulance, it frees up the paramedic's hands. So we get that machine on, and now he's not tied up doing, or she is not tied up doing CPR. They're giving medicines or they're doing something else for the patient. So it just makes the entire event be better off with better outcomes for our patient.
I got to see that piece of equipment in the emergency room, and I know we say cool, and it is a cool piece, but it's also a very obviously necessary piece, because for anyone who hasn't done compressions, you kind of don't realize the stamina and the
intensity.
And what it takes to perform that for the period of time that it's sometimes necessary.
Right. And sometimes, you think, well, 10 or 15 minutes you can do CPR, but you wouldn't believe the energy and the adrenaline that you're, putting out trying to do this, and the fatigue is incredible, your stress and all those things. So the machine just allows us to just do better. We're safer, but we're more effective with the CPR. And some of our cardiac arrest events, unfortunately, will go 30, 40, and 50 minutes. So we've worked patients for over an hour with success, and it's hard to get a person to, you can't do CPR for an hour, but you're having to change according to the standard every 2 minutes. So if I'm doing CPR in 2 minutes, I change and let Caroline take over. Well, you can imagine how many people you'll go through trying to get everybody to do every 2 minutes of changing. Mm-hmm. And the main thing is so that we're still giving consistent compressions. The machine always gives consistent compressions. And so that's why that machine was just invaluable to what we were able to do, or what we are able to do. So.
Yeah, and I know just as a member of the community, knowing that that's there is, that's a good feeling to know that that would be taken care of if me or a family member, whoever, hopefully would not need it. But if so, knowing that y'all have the best equipment possible.
Yes.
Awesome.
And as an employee giver myself, I like hearing kind of where all that money goes to, and kind of the unique pieces that it can go to support. So either one of you, how do you feel like this employee giving kind of strengthens or is part of the hospital's mission?
I'll start out, Bret.
Okay.
Well, the hospital's mission is to be the difference. And this campaign, the employee giving campaign, allows our employees to give back to the hospital. It gives them meaning and purpose. They can invest in where they work, and they are improving the quality of our care, patient safety, and also making it a better work environment for all of their staff. So they're not only supporting our patients, but they're supporting each other. And I think that's really important.
Everybody wants to be on the winning team. And so that's what you get to do. Your contribution or your giving, you will need medicine. There's no doubt about it. At some point in your life, you're going to go to the hospital, you're going to have an outpatient procedure, you're going to benefit directly from something that Athens Hospital is producing if you use our local community for healthcare. So it just makes you feel a part of something, whether you're actually doing patient care or whether you're providing money that buys the equipment that performs patient care. You're a member of the team, and that's important.
That is so important. And I know, like, for the annual giving, I know we've had some of our community members kind of reach out and kind of do some unique things to help raise money themselves for the hospital.
Yeah.
So have you kind of got a story or something that you can share from a situation like that?
I do have a cool story, and this, explains the power of giving and the ripple effect. Once one person gives, then another one and another one continue to give. And so we had a need at the hospital. We needed a golf court to transport families back and forth to be able to aid if there was someone with a physical challenge. It might help them get to their car easier or get them to the hospital. And so I actually reached out to our foundation board and I said, hey, here's this project. This is how much we need to raise. Would anybody be interested? Would your business or as an individual, would you be, interested in supporting. Well, before I knew it, one person reached out and said, hey, my business will pledge so much. And then someone else replied and said, I'll pledge this amount. And then it caused a ripple effect. And within an hour, we had the whole project funded. And that was a really exciting day, because sometimes projects like our annual giving, it may take a year to fund something, or even 2 years, to raise all the money for a project. But that one was really exciting because I got to see the power of giving and how encouraging it is to see one person give, and how much good it brings. So that was a cool story for me.
That is cool. And I've seen the golf cart in use, so it certainly does help with our parking and kind of helping people get to the door that otherwise, between walkers or anything like that, makes it a lot easier.
Absolutely.
For them. So, yeah, that's a cool thing to be able to have at the hospital now.
I know we've talked a lot about employee giving, and going more to the annual giving, I know the company I work for, Ridgeline, has participated in the annual giving before. Can you talk a little bit to kind of businesses and how they can help?
Absolutely. We have different events that our local businesses are so awesome to support every year. And Ridgeline has been an awesome supporter of our Pink Elephant Fund. And there are different programs and funds that we have at Athens-Limestone Hospital. For example, we have a Pink Elephant event every year. In the past 3 years, we've done the Canestrari Witches Ride. And there are sponsorship opportunities that businesses can support at a certain level, and they get promotional benefits, and they get to be involved with entries in the event. And so our Pink Elephant events, that program is really awesome. We've had the Pink Elephant Fund for several years at Athens-Limestone Hospital. This is a breast cancer fund that provides mammogram scholarships for women that are not covered by health insurance. I feel like earliest screening possible and earliest detection is the most important, and we want to provide that in Limestone County. Also, we have been able, because of these events and raising money from the Pink Elephant Fund, we've been able to upgrade to 3D technology with our mammo machines. We're really excited. We were just able to purchase a new specialized ultrasound machine that it's going to examine dense breast tissue. So if a woman gets a mammogram and something lights up and the physician wants to look deeper into the dense breast tissue, this is a new specialized piece of equipment that we've never been able to offer in Limestone County that we're now going to have. It's been ordered. We just ordered it, and this is all because of businesses like Ridgeline that have supported our events over the years. And it's so awesome and exciting to be able to offer this technology to our community into Limestone County. And we have Pink Elephant events every year, and our Pink Elephant Luncheon is going to be this year on October 29th, and we're really excited to bring this event back.
Yeah, and we're going to be able to talk more about that new imaging thing kind of this fall when it gets here. We'll get somebody on here to talk more about that.
Absolutely.
So with
can I interrupt you a second?
absolutely.
I've got a unique story.
Okay.
We were renovating a house for EMS, so when the crews aren't on a call, they've got a place to hang out. And so we didn't have any money, of course, because this renovation just came up. And so I called Caroline, and there was a local window company in town, Quality Vinyl, that wanted to help us out. But we didn't really have money to pay them, so they said, well, what can we do? We offer the gala that is awesome. It's a great event. It's a fundraiser. Caroline gave away a table to the company for their employees to use to come to the gala, and they put windows in our house. So it's not all about just money. Sometimes there's services that a company has, and we were bartering. They were picking at me about, here's Bret out here trading things, but they wanted the gala tickets, and so they got a table. They got to, treat their employees, and then we got new windows in our house. So it was really...
I appreciate you saying that, because that is a creative way of giving. You don't just, you don't have to support financially by making a donation or an annual donation. Businesses, those are called in-kind donations. You can provide a service or a piece of equipment or something that's going to aid in the hospital, a type of service, and those are in-kind donations, and those are incredibly helpful to the hospital.
Well, and I know at some point we'll probably talk more in depth about the baby box and what that program is, but that in itself was kind of a combination of all of this, because I think employee giving paid for a small.
They paid for a small part of it, the
Part of it?
alarm installation, and then I know we had some amazing community supporters
Right.
that funded the project. And Bret can tell you a little bit more about
Yeah, I
that.
think Bret had to get creative with that too.
We did, and it was funny. Caroline talked about the ripple effect, and some of it's just flat competition. You know, if one group hears that they gave this much, then they want to outdo that group, and so you don't pit one against the other, but you do make sure everybody knows, hey, here's how other people are coming alongside us to help make this project. And that project, it took a lot. And so we had people donating everything from sod to gravel to actually buying the baby box, which the Farmers Federation did. And it was an incredible gift. And that was their fundraiser. They were getting money and doing things. And they just, they kind of took it on as their mission. They wanted to provide the Safe Haven baby box for Limestone County. So they were the ones that instigated or started this, and then they came to us as the recipient of the baby box, and then we had to do the work to actually have it installed on our campus, and we keep up with the alarms, and we handle the issues that come up from a baby being put in the box. And but it really was a community effort with all the different people that came together, and so it was. And now we've got a service that we hope we never need, but if a mother needs it, we've got it available.
These are great stories about exactly how the money is getting used at the hospital, and so beneficial for people to see that's where their dollars are going to, or these special things that make such a difference and support the employees who we know make a difference every day. So, kind of, Caroline, how do you see the foundation growing in the next 5 years? Kind of what are some plans or expectations?
So actually yesterday I was looking at numbers, and it's been really cool. We were able to pull some numbers back from 2006, and since then we've been able to raise well over $5 million for the foundation to give straight back to the hospital, whether it's a service, a piece of equipment, or a program to support. And my goal is to continue that growth. I want us to provide the best quality care. We may not be the biggest hospital, but we're a really special hometown hospital, and we provide a special kind of care to our community. So I really see, we're the fastest growing city and county in the state of Alabama, and I really see the foundation continuing to grow. It's grown every year. We've been able to raise a little bit more every year. So that's my goal, is to continue that growth to better our, equipment, better our patient care and patient safety.
Yeah. And if every employee kind of gave just a little bit, what kind of difference do you think that could make?
Oh my goodness. I mean, you can give as little as $1 a paycheck, and this bi-weekly. If you were to add those up, it would make an astronomical impact on the hospital. We are able to raise about $55,000 every year annually from our employee givers, and we've been able to increase that. And I hope as we continue to hire new employees and we present to the new employees at their orientation what the foundation is and how those Helping Hands grants benefit the whole hospital and all the clinics, I really, hope that it will continue to grow and that our employees feel led to give and feel, the need to invest in their workplace to aid their patients and their staff.
I think Caroline and the Foundation Board do an incredible job of dispersing the funds so that, when employees get to see the direct benefit in their department of the donations that they gave, then it encourages them. And so, it's not just one department that gets everything, because there's certain, the OR, the robots in the OR are millions of dollars. So if we could take all of our money and try to fund the OR and nobody else would get anything, but they do a really good job of the smallest departments to the large departments, everybody getting a little piece of the pie, and that encourages other givers because they get to see a direct result.
Yeah, I think quarterly you kind of review the different grants, kind of there's maybe 10 a quarter that you're reviewing. Does that sound right?
Yes, so there might be a little more that is present, that clinics and departments within the hospital apply for. So we usually grant, in the quarter about 10. And I brought, I was looking at all over the years what all we've been able to do because of our employee givers. It's amazing. Not only for the departments in the hospital, but also all of our clinics. How many do we have? Is it 21 clinics?
Yes.
Yes, so the clinics, they can even apply for these grants, and it may be something that they need at their clinic that's going to make just their everyday, monitoring or their patient care or trying to get vitals, like a new vital spot monitor or an EKG machine, or like the education department might need new monitors to present orientation and education to new employees, or CPR training, mannequin devices, those kinds of things. So it's really cool to see.
It's obvious you both have a passion for the foundation and for the employees and kind of for what these funds are used for and the impact that they make. So kind of in closing, just kind of a little fun question, but Caroline, if you were to have one dream project or dream event to raise money, any ideas kind of what that might be?
I think a lot of people, along with me and our hospital staff, like one big dream, it would be a new hospital. We are growing so fast, and our hospital was founded in 1951, and you start to get landlocked and you want to expand services. So that would be a dream of mine, to start a capital campaign and really get the community fired up and passionate about raising money for a new hospital. That would be a dream, and that we could expand our services to offer more services to our community in Limestone County. That's a dream of mine.
Yeah. Talking about the growing community, I kind of found it surprising when Bret said that there's 10 on the road and every day. That's kind of surprising to me.
Well, and unfortunately, there's still days when I run out and I've got calls holding. We don't, thank goodness we don't hold 911 calls, but I've got patient transfers that we have to delay, get that patient from one to the other, because all my trucks are running emergency calls. So, and it's doing nothing but getting busier. And,
Yeah.
when you recruit industry to an area, and we're blessed because we've got so many people coming, they look for two things: healthcare and education. That's what makes a family want to move to an area. And so, thank goodness our schools are in good shape, and I believe our hospital and our healthcare offerings are second to none. And so that's what makes people want to move here. So we got to keep up.
Yeah. Well, I appreciate y'all so much. Anything that you have left you'd like to ask, Karina?
No, I think y'all covered it, and I'm feeling like I'm learning things and about new medical devices I never would have known about, and I think it's fun to learn about those, but also realizing that, like you were saying and like we talked about earlier, it could be you that needs it at any point. It could be a family member, and we all benefit. The whole community benefits from the things the hospital gets. So
Absolutely. Every donation, whether small or large, makes a difference. It all works together to make a tremendous difference.
I think that's great. And so for more information, obviously, social media, hospital has a Facebook page, but I know the foundation has its also a separate Facebook page where you can follow for events and for information.
Yep.
So.
We put all of our information on our social media pages, Facebook, Instagram, and we also have a website, and we put everything out there too. And you can always reach out to us if you have any questions or are interested in funding something that you're interested in.
Great. Well, thank y'all so much for being here today. And I know Caroline will be back when we talk about some of her events as we get close to the Pink Elephant Fund. You'll come back and talk to us about what to expect and how to get involved in that program.
I'm excited. Thank you so much.
Thank y'all so much.
Thank you.